Oxidation occurs because we breathe in oxygen. We can't stop oxidation. There are enzyme systems that will try to keep it under control, but diet clearly has a role in how much oxidation is occurring in our body. So to excess oxidation, as I said, we can't stop it, but you want to control it. From a heart disease standpoint, it's the oxidized LDL, oxidized low-density lipoprotein, that's related to atherosclerosis. Healthy LDL is not related to disease. Your LDL could be 200, it could be 220. If it's healthy, it's not going to lead to heart disease. Your LDL could be 100, but if it's oxidized, that's where you're going to see more disease. From a cancer standpoint, oxidation of DNA turns on some of the cancer genes. Oxidation of cell membranes. When the cell membranes are oxidized, you can have cancers leaking into the cells. The cells aren't as healthy. Things leak in, leak out. Not a good situation. Polyunsaturated fats, which are found in vegetable oil, will all oxidize. Any of them will oxidize, whether it's sunflower oil, soybean oils, fish oils. They will all oxidize. And there are plenty of studies out there showing that vegetable oil will oxidize the LDL particle. Vegetable oils also, because of the polyunsaturated fat content, will end up populating the cell membranes, and that's how you get membranes that are not as healthy as membranes that are the people not consuming polyunsaturated fats. Also, as you all know from basic nutrition, that we don't make these types of fats. These are essential fatty acids. So if you find them in the body, they're from the diet. You're not going to do that. If someone isn't eating these oils, you're not going to see these polyunsaturated fats in the body. So you do have to eat them to get them into you, which is good, because you can change whether you eat them or not. Extra virgin olive oil, because it's mainly monounsaturated fat, it doesn't oxidize. In the United States, this is why olive oil is labeled as healthy, because of its monounsaturated fat content. I think it's nice that it's a lot of monounsaturated fat, but I don't think it explains at all what is the benefit. But I think where you see the health benefits is when you look at the phenolic content. So for instance, if you look at a moderately high, 366 milligrams per kilogram, and compare it to a 164, which is like a blended retail, in that oil, and then you compare it to refined, so a lower one. This study, when they looked at this, that LDL oxidation decreased only for the oil that had 366 milligrams per kilogram. So it was truly the extra virgin olive oil with a moderate high phenol content as opposed to the retail one. So those are the retail olive oil. In this one, this is a high content of phenols, but compared it to, again, a retail type level, but this showed a decrease in DNA oxidation. So this is where I think that work needs to be done. This is where I think we need to educate our patients that you're using specific extra virgin olive oils and you're using specific levels of phenols. And this is something that's going to come about. I think more and more people are going to, in the market will do this, because I think this is where we'll see much more health benefits. And extra virgin olive oil clearly decreases the oxidation of LDL. And that's the important point. How do you keep someone from getting heart disease?